Dr. Bob, what causes muscle cramps? You know, that's really a good question. Let's talk about a muscle cramp and what it is. These are what we call striated muscles. These are skeletal muscles. These are muscles that move the arm and move the leg and move the fingers. Those muscles, if they suddenly contract and stay contracted and you can't loosen them up, that's a muscle cramp. Frequently occurs in athletes who are overusing that muscle, and while they're using that muscle, it just becomes so fatigued that it will cramp. It says stop. There's others that as we get older, resting seems to cause those muscles to cramp. People that have been hikers, that they suddenly hike up a mountain, they come the next day, that muscle has been overused, and when it's overused and they rest, it may cramp. Athletes that become dehydrated, or if you and I become dehydrated, it frequently leads to cramping. Calcium, magnesium deficiencies in the bloodstream seem to cause people to have muscle cramps. If you have muscle cramps that are frequent, you need to talk to your doctor about it. What can you do? Well, sometimes we give a vitamin B that will help. We don't know really why that is. Sometimes we check the calcium and magnesium. We get that corrected. Sometimes we tell people they're just not hydrating enough and they need to have some hydrating fluids like Gatorade that will replace some of the electrolytes we need. Waking up in the middle of the night with cramps, sometimes we need to stretch those muscles before we go to bed. That may help. There used to be a medicine, but it's taken off the market, that we can't use called quinine, but we don't prescribe that anymore. It was good for night cramps. You're going to have to work that out with your doctor if they're too frequent.